reassurance in terms of everything's okay, but then maybe a little bit more of an objective method to refer sinister lesions. And again, I would be really interested to see the data to see whether it's enhanced the speed of management for the sinister lesions. So obviously, 2-week pathway is still the 2-week, the national approach for these cancers. But if something looks more sinister, has that actually sped up the management of those cases? Equally, things that look much less sinister that you normally would do via a 2-week wait. So so has the actual outcomes in terms of the patient, management, that improved? That'd be interesting to see if that makes sense.
I think that's also a really interesting point, coming back to what when we were talking about that integration within System 1, for example. That's a really interesting point about having that feedback on what impact using this platform has had on the patients from a kind of a objective outcomes point of view, because that I suppose gives you an indication of things.
Yeah, because I think with skin, I think it's generally younger people that would present who are worried, especially with lots of stuff in the news and so forth. It's quite a hot topic. So I think perhaps that reassurance that photos have been taken in that young age group may have a better sort of patient outcome experience compared to, say, an older individual who's got stomach issues, who you're referring to a stomach specialist. It's not as pressing, perhaps. But again, I'm not hypothesising there. It'd be interesting to know what the data says.
Yeah. And I guess, do you think, from your end, the specialists are getting, the consultants are getting more referrals for things like 2-week waits and kind of concerned lesions because the platform's there, or do you think anything's...
Yeah, I think my gut feeling would probably, they are. Again, I think it'd be really interesting to see the data, whether the stuff that we are less concerned about is that actually picking up more sinister things, or actually the other way around, are we really worried about stuff, but actually there's a lot more benign, So yeah, my gut feeling is probably that yes, it's meant purpose to be more referrals. Whether that's a good or a bad thing is obviously a slightly different question, but one would hope that actually it's the outcomes are really positive from it, especially if the turnaround time is that quick. Again, we're talking about things to look at, and a consultant within a few seconds can come to a diagnosis, compared to, I keep going back to gastro, but in terms of a complex stomach issue, which will take CT scans and so forth to kind of really work up and manage. So I think it certainly has its place.
Super. And I think, really, to be honest, that's everything from me. I think what I've really taken from sort of speaking to you today is that this is wholly positive, with bits that can be improved in terms of the process and potentially integration things that we can think about, but actually from your side and using it's not been not really had any sort of sticky bits from kind of a clinical perspective. And I really like your point about getting that feedback out of the system and that kind of learning process, that kind of wider learning process. So yeah, that's all been really helpful.
I've just had a quick glance at my emails, because a few of my colleagues have just wanted to sort of relatively things. I don't know whether it's appropriate just to kind of add on.
Yeah, absolutely. I was about to say, is there anything else before we finish that I haven't covered, or you want to tell me, or you want to explore? So that would be perfect. Yeah.
So this is just from one of my very experienced colleagues, who I'd say is a dermatology sort of expert, who uses it now and then. He says overall dermatology is brilliant. Took a while to get in for all the practitioners to get signed up and passwords. I think he had to sort of go quite back and forth with the admin team to kind of get that sorted. We had lots of sort of unable to sort of log in and things to begin with. And he said that was quite difficult, especially with our trainees. So we have obviously F1-2s and registrars that, they start seeing patients we haven't been able to sort of log them on initially. But he says equally that's all seems to resolve now. So there was a little bit of issues when we first set up in our practice. He says obviously he rarely uses it, but he's very, very encouraged to sort of carry on, with the service being there. And then just my colleague, who's an AMP, said that she's not received any formal training with it. I guess that's probably just going to be some in-house things. But again, she would love a sort of a formal course. And again, that's coming from perhaps someone who's sort of less experienced, like an AMP, to have that reassurance that they've had some robust training to know that they've done it sort of properly.
Yeah.
So that was about the final thing to say really quickly was my colleague was wondering about extending it obviously to rashes. And just expanding the service in that regard, because I guess for him that's probably where there's a little bit more doubt as to the diagnosis, and maybe moles and growths are a little bit more easy to sort of say yes or no. With rashes is a little bit more vague. That's probably where I think more experienced GPs would probably use the service, whereby they've tried lots of treatments in general practice, rashes going, to get that advice that way, rather than just writing a letter with no pictures about a rash. So that was the feedback that he wants to give.
That's really helpful. So alternative additional uses for it, and where is the scope for expanding that?
I think so, because I think in general practice, I think we're quite comfortable in sort of giving a good go in a variety of the commonly used sort of treatments for a rash. And then when you're kind of exhausting your list of options, you then have to write to dermatology, obviously without any photos. You have to sort of verbally, dictate what you can see. That takes time to see there. But again, if you had maybe a slightly quicker response, and they can say, no, absolutely, this is an eczema, hit it hard with steroids, you might be able to continue that patient care. And that was just one other thing that my colleague mentioned.
No, that's really helpful. As I say, all those extra bits are always the little nuggets at the end that we like to get.
My personal thing is the interaction with Sister One. I think that would be nice to sort of close that loop some way, in terms of that's not more work for any of the parties involved, but it just means that it's embedded and it's documented easily. It would be one thing.
Some sort of automated closure of the loop.
Yeah, sure.
Cool. Have you got anything else? I'll make sure I ask that.
No, not that I can think of. No.
Perfect. And if anything does come back to you at any point, just ping me an email and we can do a quick 5 minutes just so I've got it recorded, or you can send me an email with any additional kind of comments. If they're just, this has just come to me and actually I wish I'd said this. But we don't need to talk about it. It's just an extra point I wish I'd made. So do come back to me. All of those extra bits are super helpful. And I guess really it's just a thank you for your time. I know how busy everybody is, and without these interviews we wouldn't get anywhere near this kind of understanding of actually how it's used and how we can start to think about going beyond what we have in terms of the kind of the quantitative data. So that's really helpful. I am going to stop the recorder now. All right, so let me just ping that off.